he converts a lot of if they come in for a runny nose, the culture is he looks to see, can this be converted to a well visit? And he often does that. Old school thinking was, they're here for a check, runny nose, let's deal with that and come back next week for a checkup or next month for a checkup. But people need access to care because especially this new generation of parents, everything is an emergency.
Yeah. Let me tell you how we manage that a little bit differently. So we don't actually have a triage nurse here. It's a different way of doing it. So we're very active in the patient portal. So when medical questions come in, they come directly to the provider, right? And our schedule, we probably see less appointments per day than most practices because I think our practices are more checkups. And so we space out our checkups. We have time in between our visits. So we're always on the computer. We're busy during the day, responding to portal messages, and the messages are very repetitive. And so we have good 20, 30 pages of kind of responses that we use a lot, and we just tailor them to what they're saying. And we offer them the advice directly from the doctor. So they feel like they might as well be in front of us. And we always will say, if you still have any concerns, please come in for an appointment. We have plenty of slots for sick visits. So we want them to know. And if they just write a message saying, hey, my child is this, I want to come in for an appointment, then they're scheduled. There's no barriers. They don't have to go through anybody to get an appointment. They can always do it. But most are happy just to know that they've spoken to us. They have some reassurance. This is our advice. And that's where sort of making sure we all practice the same medicine, the practice that the advice is the same. And when they come in person, they hear the same words. Yeah.
George is going to tell you this. You can hire another clinician and see all the sick visits and generate revenue.
The people on SOPM will say that's another service that you provided for free.
Yeah.
All these things add up. Add up.
You're right.
That goes into physician burnout.
Yes.
No, we'll tackle that in a minute because I have a very interesting conversation on that. But first, before we go there, I want to just pick your brain a little bit. How does what you have built, which is a beautiful office, it's very intentional, very vision driven, allowed you to recruit, hire, and maintain ancillary services like embedded mental health and lactation consultants, which most big practices can't even bring in, but you can.
Yeah. I think you have to be very intentional with that. If it's important for your practice, then you just have to start somewhere. And you go I went to the AAP conferences, and I'd go to the lectures about embedding mental health and listen to their strategies and how they're doing it. And then you just decide it is good for your practice. And everybody will agree having that is good for the practice. Now, it's not going to be great financially. Like, you're not going to turn that into a profit generating behemoth. But what you're going to do is you're going to provide access to your patients for mental health care when you can quickly get them into that. So you're not in that room trying to manage the teenager's anxiety, spending a lot of time where you could be doing other things like keeping your checkups up to date. And I think if you're very intentional, you can do it. You just have to go out and find the person, and then you have to have the space. And I think that's where offices run into trouble is when I built this office, we had a bigger space. We're bigger than what we needed at first. So we grew into it, and we had the space, and we added space about 5 years ago. And you need to add the space, right? You need your therapist to have a dedicated room. We actually built a second room as a waiting room for the therapist because we didn't want the families waiting in the main area. It just is not comfortable for them. And so I think it can work if you're intentional and you just advertise and you interview people, and what you're providing them is a guaranteed source of patients. They don't have to deal with the scheduling or the headaches or the billing of it. And then I think if you pay them fairly, it works. But you just have to decide it's important for your practice.
And everything's important. Okay.
Your side's very important for your practice. That's very important.
Mental health today is very important. Yes. It's a time suck. But everybody talks about it. Insurance companies